Hi, I'm Meshal Malik and you're watching Indus Special. Schools around the world were the first to close down as countries went into lockdown to curb the spread of COVID-19. Now, as the new school year approaches, UNICEF urges governments to prioritize the reopening of schools. According to UNICEF, 105 out of the 134 countries that had closed down schools have now planned to reopen them. In some cases, in-person classes have already begun. Given the global context, it's important to discuss whether reopening of schools can cause coronavirus cases to spike. To what extent are children vulnerable to the virus? And while all this happens, what concerns do schools, students, and parents have? Let's discuss this and more. Joining us for this conversation today is Dr. Syra, Madad, who's a nationally recognized leader and epidemiologist in public health and special pathogens preparedness and response. She is Senior Director of the System-Wide Special Pathogens Program at New York City Health Plus Hospital. She joins us from New York. Also joining us today is Dr. Peter Ogudoro, who is an educational researcher with special interest in equity, justice, and inclusion in education. He joins us from Lagos. Thank you both for joining us and welcome to the show. Dr. Syra, Madad, I'd like to begin with you. Now, when we're talking about reopening of the economy and various sectors of the economy, and then reopening schools, how do the health concerns differ and vary in those two different sectors?
Well, I think first it's prioritization, right? So the education of our children is extremely important for many different reasons, not just because of the academics, but also because of the social environment and everything else that it brings along with it. And so that really first needs to be prioritized. And in order to do so, you need to make sure that if you are trying to make sure your economy is booming and you're going to have bars and restaurants and mass gatherings and theaters open, well, what that's going to do is that's going to increase the infection of COVID-19 in your community. And we cannot have that if we want to open schools, because one of the biggest baselines that you first need to start off with before even thinking of opening schools back up is you need to have the virus in the community at very low levels of transmission. And so to put actually a number to that, public health experts are saying at least less than 5% in terms of just overall cases in the community, and even the percent positive of cases. And so that's really first needs to be prioritized. Then you can have some sort of a discussion of how to open up schools safely by having various controls and mechanisms in place. But really, we need to make sure that economy is very important. I definitely don't want to argue that economy and the livelihood of people is extremely important. We also need to make sure that there's active steps we can take to mitigate having a lot of infection spreading in the community by closing down some of these indoor gatherings and making sure that we're prioritizing schools opening up first.
Dr. Syra, Madad, that's very, very important and interesting point that you say that when we want to reopen schools, we need to prioritize those institutions and make sure that there aren't other public places open that could create spikes. In this conversation, I want to know how much of it can be extrapolated to other parts of the world, not just the United States, what you're saying right now.
I think this is a pretty a basic foundation. This should serve as a guidance for countries and schools all around the world, because COVID-19 is affecting all of us, and we want to make sure that in any given community, in any given geographical location, that you have low enough levels of COVID-19 that you can safely open schools, and that low enough levels is about less than 5%. And in fact, some argue it should be less than 2 to 3%. Here, for example, I'm in the state of New York, and I'm heavily working towards our COVID-19 response. Our percent positive is less than 1%. Just over the past few weeks, we've tested on a daily basis over 70,000 people here, with a very, very small percentage of people actually having COVID-19, as I mentioned, less than 1% positive. And that shows you that we can safely and effectively open schools in the community, because we know that the chances of having an outbreak will be lower. It's not going to be zero, right? So I think people are thinking that, we're not going to have outbreaks in school. That's going to happen, and we need to plan for those types of outbreaks, but we need to make sure that we're decreasing the chances of those outbreaks and then having plans in place to actually address them. So isolating those that are sick, quarantining those that have been exposed, and then going from there.
Right. That is packed with so much information there. You're answering something that we can pick apart in so many ways, but just that very basic fact that you're saying that people are underestimating or perhaps ignoring the fact that there will be outbreaks within schools. I think this really takes us to the perception people have about how susceptible children are to the coronavirus. How much more do we know about that? Because in the beginning, it seemed like those age groups really weren't being impacted in the virus in the same way that other age groups were.
Well, I think that gave us a false sense of security because early on in the pandemic and even across the world, what we did was we shut down schools. And so we were shielding these children, so we didn't actually realize the full extent of, transmission and the sequelae that children may have if they become infected with COVID-19. So we had this sense of security saying, well, oh, kids are not going to get infected. That's because we were shielding them. Everybody, the schools weren't open. Now that schools are opening up in many parts of the world, we are seeing a couple of things. First, kids can get infected with COVID-19, all right? And then second, kids can actually transmit COVID-19. So even if they may not actually show signs and symptoms, they can still transmit the disease. And if you look at their viral load, it is very comparable to those of adults. In fact, in certain circumstances, they may have a higher viral load. And what viral load means is an amount of virus that's in, for example, the body, right? And so it is very comparable. And so I think it's very important for people to understand that children can not only get infected with COVID-19, they can also transmit COVID-19. Mm-hmm. But we are seeing that kids in general, they don't have a more of a severe outcome. But that's not to say that they're not going to, right? So they have a less chance. But I think, again, another very false sense of security we have is we look at COVID-19 and we look at diseases in general, but the number of people that die from it. And that is a terrible way to look at the full burden of disease, the full burden of illness. Because if you're only looking at the number of people that die from, for example, COVID-19, you're not even looking at the people that have long-term illnesses and long-term consequences. Right. And that is something we actually still do not know, specifically even for kids. So even if they do not show signs and symptoms and they're transmitting the disease, what does that mean in the long term for them? 5 years from now, 10 years from now, does it put them at higher risk for X, Y, and Z? We don't know that.
Right, Dr. Syra, Madad, just stay with me. I want to come back to a couple of points you mentioned here, but I'm going to bring in Dr. Peter Ogudoro into this conversation and talk to him about the on-ground situation in Lagos. Dr. Peter Ogudoro, now in Nigeria, we're seeing almost 54,000 cases of the coronavirus. We're also seeing schools tentatively being planned to open on the 14th of September, 21st of September. That false sense of security that Dr. Syra Madad just talked to us about, that children might not be susceptible to this virus, that they're not that much of a threat. This virus isn't as much of a threat to them. All these factors that are creating that sense of security globally, do you see that also happening where you're talking to us from?
Well, the case of Nigeria is significantly nuanced. We have a variety of factors that are putting government agencies under pressure to reopen the school system. We know that those factors include the fact that about 50% of Nigeria's education system is run by the private sector. And this is a sector that also provides employment to people who are teachers and who are school owners, and who in some sense see it as a business. So it's not just about educating children that is at play here. It's also about giving people means of life, the teachers, the non-academic staff, and the people who run the school system. I must put it on record that we have about 15% of school children at the secondary school level have already resumed. They are currently writing their end of high school exams, and they have been doing this for close to 2 weeks now. And unfortunately for us, we haven't been able to put in place a research, a system that enables us to verify the extent to which what has happened in terms of the children being back in the past 2 weeks has impacted on having a spike, or are we still where we used to be? Has any difference been recorded as a result of children returning to school? We don't have the research capacity. The manpower here doesn't seem to be at the level where we can do as much as people in America and governments in America and Europe can do. And so our case is a bit complicated, and those of us who do research in education in Nigeria are wanting the government, to be careful about how they bring the entire population in the school system, right from primary to universities, to getting them back onto the school system, because the challenges are going to get enormous. We don't have what it takes to manage a very serious crisis in case there's a huge outbreak as a result of what is about to happen. But again, the government has promised that they might also rescind, the order to have schools reopen on the 24th, depending on what happens between now and that point.
Right. So there's a lot of developments that are waiting to happen, and there's a lot of questions that still need to be answered. Dr. Peter Ogudoro, I'm going to come back to you, and we're going to talk about the sentiments of the students and the families and all those apprehensions on ground. Dr. Syra, Madad, let me just come back to this very, very important point you mentioned earlier on, which was that we need to anticipate that there will be outbreaks, but we need to have plans in place prior to that happening in order to deal with them effectively. What are some of the things you can tell us that countries all across the world, some bare minimum things that they need to put in place in order to deal with those outbreaks when they happen in schools?
So, we can categorize that by three different categories, needing to make sure you have engineering controls, administrative controls, and physical distancing controls. And what this means, for example, is that if you're having children come back to school in person, you want to make sure that you spread them out. You want to make sure that you're limiting the class sizes, that you want to also have personal protective equipment, not just for the staff and the teachers, but also for the children. So making sure that they're wearing masks at all times. And obviously they can't wear a mask if they're eating. So having some sort of a process where they can safely eat, maybe even giving some mask breaks, right? You can't expect children to wear masks 8 hours a day. It just becomes very cumbersome. So planning through some of those processes. Ventilation is another big key. So these are the engineering controls, making sure you have good cross ventilation in the schooling, whether you're doing it indoors versus outdoors. And then very importantly, having a plan that when you do have cases, and again, this is where I say you always need to make sure you have a plan when you have cases in schools, because it's going to happen. It's inevitable, right? This is a very ubiquitous type of virus. And so when you have these cases, you want to prevent clusters, you want to prevent clusters from becoming outbreaks. So you want to make sure that you are isolating those particular cases, you're contact tracing, you're quarantining them, and then having a plan in place that for those children that have to be quarantined for 14 days, what is the school going to look like for them? Are they going to go back to online learning for those 14 days? And then cleaning and disinfecting the environment for those children that were in that particular area where there were confirmed cases. So all of these plans really need to be thought out and need to be put into place, and that needs to happen now, obviously, before schools open up.
Right. Thank you so much, Dr. Syra Madad, for joining us, and thank you so much for all the work you're doing, bringing us so much information and all the work you're doing on ground to fight this virus. That was Dr. Syra Madad joining us from New York. Dr. Peter Ogudoro, let's go back to you and talk to you about the situation in Nigeria. Nigeria having one of the biggest populations within Africa, and it also having such a huge youth bulge. Of course, everyone wants schools to reopen. There's so many concerns about how online learning is creating greater barriers for students to learn or to participate. All of that happening on one end, but actually reopening schools. How do families and how do children feel about that happening, especially when there's so many children to voice their concerns from where you're talking to us?
Yes, the children indeed are very happy to return to school. They have missed their friends. You know that Nigeria is not a country that is at the moment at a cutting edge level with respect to technology. So we are not able to make learning happen effectively for the majority of our children using online platforms. So the only way we can reach the greater majority of Nigerian children is to educate them in person, because that's what we can afford at the moment. And so the children are looking forward to it. They are happy to return to school, but their parents are apprehensive. They are not very sure that, given what they know about the governments across Nigeria, that the health of their children can be guaranteed. There's also the fear that these children will go to school and then pick up this virus and return to homes and spread it among the older population who are more disposed to coming down with COVID-19. So that challenge is there. So for sure, children are happy. They are looking forward to returning to school. Parents are apprehensive, not only because of the health of the children, but also because they have to pay school fees once schools resume. Because somehow, as I mentioned earlier, the Nigerian case is a bit peculiar, because when you ask children to return to school, they are also asking their parents to get ready to pay school fees. So that there is that concern about where they will get the money from, because they haven't been working for upwards of five months now since we've shut down the economy. And so there's no money to pay school fees, because government in Nigeria has not been as responsible as you would expect in terms of taking responsibility for children education. And so those issues are on the table, and everybody seems to be wondering how we're going to resolve all of that.
Right. Dr. Peter Ogudoro, in this entire conversation, I think it's important to highlight why we need to prioritize the reopening of schools, and in the safe manner that Dr. Syra Madad earlier laid out for us. But Nigeria has had one of the highest number of children that have been out of school. With this virus, how has that issue been exacerbated?
Yeah, it's worse now because over 95% of Nigerian children have not had any form of education since we shut down the system over 4 months ago. Because, as I have indicated, we don't have the technology it takes to reach the majority of children who live in rural communities and whose parents are so poor they are not able to provide them the technology that enables them to have access to education in the kind of environment we are operating, at the moment. So it compounds the out-of-school children's situation we have had in Nigeria, which is traceable largely to the security challenges we have had in the northeastern part of Nigeria. But with respect to the southern part of Nigeria, the problem is not as terrible as international media have been reporting it, especially with respect to security. But overall, we know that we are not where we should be in terms of getting all our children to be in school, even in normal times. So it's worse now that coronavirus has come to compel us to keep over 95% of them at home. But the children of the eldest, about 5% of the school population, have continued to receive education. Some of them have finished their last session, have even resumed a new session because their parents can afford to put them in private schools where they pay good sums of money to enable those school authorities to keep providing them learning, which again raises issues of equity, fairness and justice with respect to how we provide education to Nigerian children. And that, I think that is an area I'm particular about, because it makes it difficult for the children of the poor to migrate out of poverty and then climb the social ladder. And that is not going to happen because of this kind of situation. So coronavirus has exacerbated these challenges, and will continue to create more problems for the poor in this part of the world.
Right. Stay with me on that point. I want to pull in a new guest who's just joined us, Ms. Saima Asghar Riaz, who has extensive teaching and teacher training experience. She is the CEO of Solutions to Enhance Professional Skills and has been working with UK higher education admissions for 22 years to support students through guidance and counseling. She joins us from Dubai. Thank you so much, Ms. Riaz, for joining us, and welcome to the show. As we are talking about UNICEF claiming that governments all around the world need to prioritize the reopening of schools and educational institutions, there's a lot of concerns that are pouring in that we're hearing about, and naturally so by parents and by students. You directly deal with so many students. What are some of the main concerns that they are voicing at this time, and especially putting them through to you so you can ask educational institutions further?
You mentioned parents and students. There is also a very, very important body of teachers who are expressing a lot of concern as well, because obviously they are being exposed on the front line when they interact with so many students coming from so many different homes. So that's three sets of stakeholders really who are at stake. here. And when I interact with students, of course, it's a huge concern for students, for the parents as well. I deal with a lot of students who are now heading to university, and it's a huge concern for them. But at the end of the day, as I believe the participants before me also said, it is important to open institutions. But I think what we need to be careful about is not putting a one-size-fits-all approach to all kinds of education institutions. And we have to see that perhaps the younger children can actually maybe not be sent to school immediately, and we start phasing in the opening of schools based on the level of students. So perhaps we start with, the sort of sending in the secondary school students first, and then the primary school students, because obviously it's easier for secondary school students to ensure and follow SOPs themselves than it is for primary school students. We also, I think, in terms of from the end of the education institutions, again, they need to be more adaptive and they need to be more empathetic to the problems that their parent body will face, because in a country like Pakistan, there is no uniform education system, and we have parents coming from all kinds of socioeconomic backgrounds. We have parents who can actually practice sort of more hygiene in their homes, and then we have parents who can't. We also need to make sure that, and the government needs to instruct schools, and I believe that they are, to make some form of distance learning education available to students where possible. Again, because of the vast range of the type of schools that we have and the varied socioeconomic background of students, everybody will not be able to access online education. But where possible, it should be something that schools should be encouraged to implement in whatever shape or form that they can. Obviously, the higher end schools will be able to do a lot more synchronous teaching. They'll be able to do more live streams. The slightly schools at the lower end will have to rely more on recorded stuff, which will take less bandwidth and which students can actually see maybe even on their mobile phones, etc. So we have to adapt based on the parent body and the student body.
Right. Ms. Riaz, let me ask you this. You say that educational institutions need to be more empathetic, they need to be more flexible. During this time, the reopening phase or the discussion regarding how we're going to reopen, whether their institutions should reopen, in this, have you seen that degree of flexibility that you would hope to see from these schools and from these institutions?
I think to some extent with some there are, but generally not. Again, I think what most people are doing is as I said earlier, they're looking at a one-size-fits approach. Everybody's panicking. Everybody's thinking, oh my God, we have to stay shut or we have to stay open. What do we do? The government will never be able to please everybody. Schools will never be able to please all parents. So in every school, there will be a group of parents who will be comfortable sending their children to school, and there will be a group of parents who will not be comfortable. And I think what we need to be doing is less judgment and more empathy on part of the schools as well as on part of the parents. I'm part of a lot of social media groups of parents, and I see so much panic about schools are opening. Why are schools opening? They want to kill our children. They're using our children as guinea pigs. And I keep saying to people, calm down. If schools are opening, it should not be mandatory for every parent to send their children to school. Schools need to be, as I said again, and I will keep reiterating, they are not being flexible enough at the moment. They need to be more flexible in terms of the attendance that they expect of students, and they need to be more flexible in terms of students opting to stay home. If online learning is not possible, students can go in, get the material from the school. Schools can give out, teaching learning packs that students can study from at home.
Right.
I'm attached to.
Right. Mr. Riaz, stay with me on that. I'm going to take what you've said to Mr. Ogudoro and talk to him about these various factors that need to be considered, that schools are not all the same. There needs to be coordination with the government on various levels. How do you see that panning out in Lagos at this moment?
The governments at various levels in Nigeria, especially state governments and the federal government, have been trying to negotiate with the various stakeholders, especially parents groups and teachers groups, as well as school owners. As I keep emphasizing, the Nigerian school system is a bit tricky. We have 50% of the system run by the private sector, who are driven essentially by the need to ensure that they get returns on their investment. So the government is working hard along those lines, but it hasn't been easy for them, and they are under enormous pressure to reopen the school system since government lacks money to pay teachers who work in the private sector. So the school owners are insisting that they should reopen the schools so that they can use that as a base to get parents to pay school fees so that they will be able to sustain the employment of the teachers who work for them. But what we know, those of us who are professionals who do especially research in the industry, is that it's important we try and be a bit careful about getting huge numbers of young people back to the school system without giving them appropriate training. Unfortunately for us, we haven't also been able to do adequate training of teachers for them to be able to work with these children in a way that everybody will be safe. And even if we succeed in providing the knowledge, awareness, and the skills for teachers to be able to help maximally, we still have to contend with the fact that we don't have all the infrastructure, the equipment, the facilities it takes, for us to keep everybody safe in the system. So we might have to probably train parents to emphasize homeschooling, especially for the younger people, before. And then send the older people who are in high school and see if they'll be able to cope and gradually get down to those in kindergarten.
Right. Ms. Riaz, I'm going to shift gears here and talk about something that you have a lot of extensive experience in, which is teacher training. And given how unprecedented this entire situation as this pandemic is, what type of teacher training do you think is required? What type of skills are required for teachers to be aware of when they're dealing with the reopening of schools? And I'm specifically talking about emotionally being present for students and also how to take care of their own mental health during this time.
That's a brilliant question, Meshal, because as I said earlier, not many people are actually thinking about the teachers. Of course, there are different skills that teachers will need. If online teaching is going to be conducted simultaneously with classroom teaching, then obviously there will be at least one set of teachers that will have to be trained to deliver online teaching. I know a lot of teachers were doing this before the summer holidays when COVID started, when we went into lockdown, and we need to make sure that those teachers are supported and they are trained to actually deliver. When earlier they were delivering online teaching, a lot of it was very on the spur of the moment, but I know that schools and the government and public sector universities even have taken initiatives to train their teachers in that. So that's the pedagogical aspect of it. Now comes the human and emotional aspect. And of course, they need training, of course, in making sure that the SOPs are being implemented. They need to have some kind of training in terms of supporting the children psychologically. Schools, especially schools who can afford it, schools who are charging exorbitant fee should be able to afford it. They should have some therapists at hand who can actually come and speak periodically, not only to the students but also to the teachers. And so that's the teacher's own mental health. And also we have to understand that we're dealing with parents as well who also need support, because a lot of parents are going through a lot of trauma. Some of them have lost their jobs, some of them have had to take pay cuts. So in that, again, schools need to be more flexible in perhaps, I know that the government has mandated some discount, but that was pre-COVID. But schools also need to be empathetic to individual cases. If they can't give sort of an across-the-board discount, then they do need to be empathetic to individual cases where parents can provide evidence that they no longer have the ability to sustain paying the tuition fee, or they've suffered a loss of an earning member of the family because of COVID. So, any kind of mitigating circumstances should be taken on board by the schools. And the same goes for perhaps for those children who are going to be studying at home. If distance learning is made available, then the employers of those parents need to be empathetic. Because obviously one major factor when we have children studying from home is that parents have to go to work. And if both parents are working,
right,
which in a lot of cases now in Pakistan they are, then who is the childminder at home? So the workplaces need to be flexible to allow parents to continue working from home if children are studying from home.
Right. Of course, as you're saying, this entire process of reopening schools, bringing children back into schools requires effort from various sectors of society, not just the schools, not just the teachers, not just the students and parents, even businesses who need to support doing this, because if we want to reopen schools, we need to make it a priority. Thank you so much, Ms. Saima, Asghar, Riaz for joining us from Dubai, Dr. Peter Ogudoro for joining us from Lagos. We're going to go for a short break, but when we come back, we're going to update you on what is happening in terms of vaccine development efforts. Stay with us. Welcome back. On Indus Special, we've been keeping a close eye on vaccine development efforts around the world. Let's give you an update into what's happening on that front. Joining us for this conversation is Professor Derya, who's a professor of immunology at the Jackson Lab at Farmington. He joins us from Farmington. Also joining us for this conversation is Dr. Syra Madad, who's a nationally recognized leader and epidemiologist in public health and special pathogens preparedness and response. She is the senior director of systems-wide special pathogens program at New York City Health Plus Hospitals. She joins us from New York. Thank you both for joining us and welcome to the show. Professor Derya, Unutmaz, let's talk about these updates and what's happening on that front. How many vaccines do we have in phase 3 and which vaccine shows promise at this present moment?
Yeah, the vaccine front is going incredibly fast and very promising so far. Currently, we have about 9 vaccines who have passed to the phase 3. Some of those are very advanced. For example, Pfizer, they were going to recruit 30,000 people. They were already vaccinated 20,000 of those. Not everybody gets the actual vaccine. Of course, some of them get the placebo. But that's great news in such a short period. They were able to achieve that. Moderna, also, they've passed the 50%. They're also recruiting 30,000 people. Johnson & Johnson is another very promising vaccine. They've started 60,000 trial as well. Oxford in England, they're quite advanced in phase 3. So they're all going quite well. There were also, 2 Chinese and Russian vaccines that were unfortunately prematurely approved for certain populations. They haven't yet passed the phase 3 trial. So we don't know a whole lot about those. But the other vaccines are progressing. Right now, it's difficult to say which one will be the most effective. In particular, the Pfizer vaccine, they have a second generation. It's called the mRNA vaccine, similar to Moderna is making. So it makes the production much quicker. It does have the disadvantage of it has to be kept in minus 20 degrees. So that's going to be logistically a little bit difficult, but the production will be much faster. And they have a second version that looks like they have much less side effects. So that's promising. I think Oxford vaccine also looks good. I think within the next 2 months, I would say maybe around November, latest by December, we're going to know some of the initial results, whether these vaccines are working or not. And then we'll have the process of, I guess, maybe initially a restricted application to certain groups and then a widespread application, if everything goes well, of course.
Right, if everything goes well. Professor Derya, Unutmaz, should we have cautious optimism about there being a vaccine before 2021?
Yes, we always have to be cautious. I mean, what we are witnessing is really unprecedented in the medical history. The shortest period a vaccine was developed was 4 years. And it takes years and years of observation to make sure there are no side effects and long-term efficacy of the vaccine. So this is really an incredible progress. So there are some concerns, of course, long term. We will not know what the long long-term effects of the vaccines are, but we should definitely not cut corners as well, because we have to remember that vaccines are given to healthy people and hundreds of millions, maybe billions of people. So the side effects are, if they were to occur, could
Professor
have
Derya, Unutmaz, I'm just going to jump in here because this is very technical information, and since you're the expert, I know you deal with it on a regular basis. But for individuals who are not familiar with what you mean when you say these are healthy individuals and we're giving them a vaccine, what really happens during that process?
So what normally happens is that if you're infected with a virus, in this case coronavirus, your immune system starts to produce weapons and defense mechanisms. And one of these weapons is called antibodies, that are like smart missiles that will go and latch onto the virus and prevents its entry into the cells. And then you have also a command center like T cells that will direct the fight after the virus passes through the initial defense mechanism. So it really is sort of preparedness of your army within for this specific virus. So they will not know about influenza, for example, but they will recognize a coronavirus. So that happens after infection. That's why you have immunity. Once you had the infection and you recover, you will be protected for a certain period of time. So this is true for almost all infections. Now, what vaccines are trying to do is to mimic that scenario without giving you the real virus. So they're giving you only pieces of the virus, and trying to educate your immune system or your army so that they are ready. So these antibodies are produced sufficiently. When you see the real virus, then they will immediately start attacking and trying to prevent the viral entry. So that can either completely protect you, or at the very least, if the virus manages to get in, it will have a less severe disease because your immune system is much more prepared. Of course, the vaccines will be given to those who have not been infected. So these will be, relatively healthy people. Of course, you can have other conditions, but they should not be infected. And you want to give it to as many people as possible, typically 60 to 70% of the population. So you have what's called a herd immunity, because you can protect an individual, but you won't protect the society unless you give it to a large number of people. So that limits the spread of the virus. For some viruses, that might have to be 90%, 95% of the population. So that's why we have to be mindful of potential side effects when you're giving to, let's say in Pakistan, 70% of the population. That is a concern. So far, they look good, but these are, now we have to wait for these large trials where over hundreds of thousands of people are being tested.
Is there a possibility that if you get vaccinated, you will need a vaccine perhaps yearly, not just once in a lifetime shot?
Yeah, so we don't think that these vaccines, first of all, are going to be 100% protective. So the best case scenario is probably 80%, 90%. That would be great. In fact, in the United States, FDA said, if it was even just 50% protective, in other words, you vaccinate 100 people, if you're protecting 50 of them, that will be good enough for us to, approve this vaccine. Of course, it's not good enough for herd immunity. And then your question, we don't know the answer to that. That's a very important question. So far, it looks like the natural immunity to the virus is persisting short-term. Short-term meaning 4 to 6 months, because we haven't had enough time passed to know whether this will maintain itself for years. But that might be of a lesser concern. So if it protects for 6 months to a year at least, then every year we can replenish the vaccine until we eliminate the virus. We do that for influenza, although for other reasons, because the virus undergoes mutations.
Right. Thank you, Professor Derya Unutmaz, for joining us and giving us that very, very important insight, giving us an update as to what is happening on that very technical end of trying to fight this virus and develop solutions for it. Dr. Syra Madad, let me ask you now, from your perspective, when we're talking about getting this vaccine to the people, and trying to make sure, there is widespread availability of it. Do you see a pushback on the end of those who will be receiving it? Is that a concern? And if that is a concern, what are the main hindrances you foresee happening?
There's a couple of things there. First, in order to offer a vaccination, there needs to be a very big campaign that goes along with it that educates the general public on what this vaccine is, what the benefits are, what the risks are. And then once individuals do come to get vaccinated, there needs to be first some sort of a framework of who's prioritized for the vaccine. As we know with COVID-19, there's not going to be, billions of doses available right away. There's only going to be a certain amount of doses. So who's going to get the vaccines first? So, we have a number of different bodies, and in particular, actually today, I'm presenting at the National Academy of Sciences later this afternoon to talk about a vaccine allocation framework and who should be prioritized. So, there is a framework there. And I think right now it's just making sure that there's a consensus of the general public health community along with the general public to ensure they understand that when we talk about allocation of scarce resources like vaccines, for example, in the very beginning, that people know that the allocation is done equitably. There is some sort of a good framework that looks at the societal gain to get buy-in. That's very important, to get buy-in, to get trust of the people. And then once you are ready to administer the vaccine, there's hurdles like that, access to healthcare services, actually coming to get the vaccine. What we know about COVID-19, it actually requires two different shots. It requires the initial shot and a booster shot. So you have to plan for all of those things. So there's a lot of factors here at play that just need to be discussed further and really hashed out to understand we have a good, coherent plan.
Right. Dr. Syra, when we're talking 2 shots, is that a potential danger in not being able to get enough people vaccinated? Because that would require people coming in twice for it, not just convincing them to do it once, but coming in twice and getting 2 shots.
That's exactly right. So anytime that you add on, another layer of complexity. So basically now you're taking the 1 shot and then you're timesing it by 2. So not only do people have to come in for a second shot weeks later, but there's another whole supply chain aspect to it. So it does become much more complicated, it becomes much more cumbersome. And, ensuring that people actually do come back for that second time around will be a little bit difficult. Again, this is where education is very, very important, and people understanding that this is a vaccine that is safe and effective, that they should first get vaccinated in the first place and then come back to get a booster shot. Because I think once people get the first shot, they need to be educated of why it's important for them to come back. If they think that 1 shot is good enough and, I'll just go ahead and stick with it and take my chances, that's not good enough. So this is why we really need to make sure that we have a really coherent campaign that understands why this is so important.
Right, Dr. Syra, I'm just going to put the last question to you and pick up on something you said before, which is trying to make sure that it's equitable when we're talking about the distribution of the vaccine. That is the goal, global goal, and I think every rational person would agree that that is a need as well. But when we're talking about the politics intervening with this and creating perhaps roadblocks, what do you fear? And do you think we can work towards regulating this to actually happen? Do you think there are mechanisms to ensure that this will happen?
So in terms of regulating, the vaccine itself, this is something that is highly controversial. And anytime you mandate or regulate something that has to be administered into the human body, you have obviously a lot of uproar, and rightfully so. It becomes, the government have authority of, forcing me to take X, Y, and Z. So I think that's a very hot topic and certainly something that deserves its own attention. But in terms of, as you've mentioned, politics and being muddled into the societal gains or the equity of vaccines, that is extremely important. And this is why there needs to be a good framework and justification of why this is a framework by a tiered approach, right? So if tier 1 is frontline healthcare workers and those that are at higher risk, when we talk about high risk, especially for COVID-19, it's not just those that are higher risk that have underlying health conditions or that are of older age. You're also seeing a lot of health disparities play out across the world. So here in America, you're seeing a very large portion of African Americans and Latinos get infected with COVID-19. COVID-19 and they actually having a severe outcome? Should we prioritize them? And this is going to be something new. So do we prioritize racial and ethnic groups, besides underlying health conditions? So these are some conversations that not only need to happen here in the United States, but really at a global scale. So everybody understands this is a framework and this is how these vaccines are going to be administered, and really need to take the politics out of it. This is really what's going to, be a roadblock for not just vaccines, but for a number of public health initiatives that are going to continue to come out with the COVID-19 response. Politics has no place when it comes to these particular public health topics.
Right. Thank you so much, Dr. Syra Madad, for joining us and giving us your insight. Thank you for all the work that you're doing at this present moment. Thank you for watching Indus Special. Hope this segment was helpful. We will see you again next week with more stories. Till then, goodbye and take care.